Hey everyone, today we're going to talk about a study from many years ago that really challenges the long-term use of antipsychotic medications. When the study first came out, it made waves in the psychiatric community and really got everyone talking because it was so thorough and detailed. The study highlighted the negative effects of long-term antipsychotic use, suggesting that staying on these meds might not always lead to better outcomes and could even make things worse. This research tracked patients with schizophrenia and mood disorders over 20 years. I'll break down what the study set out to discover, how they went about it, and what the results mean for using antipsychotic medications over the long haul. Before I get into the details, I just want to let you know that if you or someone you know is considering stopping antipsychotic medication, it's crucial to consult with your healthcare provider first. Stopping these medications suddenly can be very dangerous and lead to things like rebound psychosis. So please get with your provider so you guys can come up with a plan to slowly and safely taper off your medication. All right, with that said, the study we're going to look at today is often referred to as the Chicago follow-up study. Back in the early 1980s, there wasn't really much information on what antipsychotics do in the long run. Most studies looked at how well these drugs worked over a short period, like say 6 months to 2 years. And even if we look at clinical trials of antipsychotics, we notice they only last for a few weeks to maybe a few months. But what happens if you're on these medications for decades? No one really knew in the 1980s, and beyond anecdotal evidence, you might argue that we still don't really know today either. However, the Chicago follow-up study does offer us some insight into the long-term effects of antipsychotic medication. Researchers wanted to get the full picture by tracking patients with schizophrenia and mood disorders over 20 years. They wanted to see how often these patients had psychotic episodes, how severe they were, and whether they were on medication or not. This was crucial to figuring out if these meds really did their job long term, what side effects might pop up, and what factors help people recover. So the study aimed to figure out if long-term use of antipsychotic meds actually reduces or eliminates psychosis in patients with schizophrenia over a 20-year period. Researchers followed 139 patients with schizophrenia and mood disorders for 2 decades, checking in on them at 6 different time intervals: 2, 4.5, 7.5, 10, 15, and 20 years after they were first hospitalized. The goal was to see how these patients fared over time and to compare those who were continuously medicated with those who were not. So this is a pretty cool study because it's really looking at long-term effects of antipsychotics, and we just don't have a lot of research done in this area, so it's kind of exciting. So the Chicago follow-up study started with 139 patients who were diagnosed with schizophrenia, spectrum disorder, and mood disorder, all meeting the DSM-3 criteria at the time the study was started. These patients were picked from 2 Chicago hospitals. One was private and then the other was a state, and it was based on consecutive admissions. At the end of the 20 years, they managed to assess 59 patients with schizophrenia, plus 11 who were tracked up to the 15-year mark. Obviously, participants in the study might die, they might move, they might drop out of the study, maybe they're impossible to locate, whatever. So not all of the 139 patients were tracked over the full course of 20 years, unfortunately. Okay, so the key findings of the study were pretty eye-opening. Over 70% of patients on continuous medication, continuous antipsychotic treatment, had psychotic episodes at 4 or more of the follow-ups. On the flip side, those who were not on antipsychotics had significantly fewer episodes over the 20 years. And it wasn't just the number of episodes. Patients on meds had moderate to severe symptoms, while those not on meds had milder symptoms. These are pretty incredible findings given the ubiquitous ubiquitous role that medication seems to play in our present day when it comes to treating schizophrenia. And I can't tell you how many times as a psych nurse I've heard providers or staff or family members, all well-intentioned, of course, tell people that they will have to take these medications for the rest of their life, despite what this study is perhaps telling us. But, and of course, those of you who have been watching my channel for some time might know that I have a bias against antipsychotic medication because of what I've witnessed as a psych nurse. But I gotta say that before we jump to any conclusions from this Chicago follow-up study, we have to acknowledge the limitations of the study because it was, unfortunately, far from perfect. Since the study simply observed patients without randomly assigning them to different treatment groups, it's possible that those with more severe schizophrenia were more likely to be on continuous medication, potentially skewing the results. Additionally, the researchers did not control for medication adherence, which could significantly affect outcomes. Patients who stuck to their medication schedule might have had different results compared to those who were inconsistent or just stopped taking their meds altogether or just took them when they wanted to, etc. Or maybe like when they remembered or something like that. So, and I feel like those or these inconsistencies in taking their medications could change how often and how severe the psychotic episodes were. So that's one limitation. And I will say, though, that the study did, however, use various psychological tools and scales to measure the severity of psychosis at the start of the study to kind of control for the initial severity of symptoms. So the researchers did this because they wanted to try to find a fair comparison between those on medication and those not on medication. So although this wasn't a randomized control trial where participants would randomly be assigned to maybe receive either medication or no medication or maybe placebo or something like that, the researchers did attempt to compare apples to apples when it came to understanding who fared better on and off antipsychotic medication. So it's not like those with severe schizophrenia were the only ones taking medication. I guess this is my point. There were also participants with severe schizophrenia who were not on medication at all. And that's what makes this study so valuable, as it gives us insight into the long-term effects of antipsychotic use. And it tries, or at least attempts, to kind of weed out any differences there might have been between the severity of someone's mental health symptoms. By the way, one fascinating aspect related to long-term antipsychotic use is something called antipsychotic-induced dopamine supersensitivity psychosis. It's a mouthful, but this condition suggests that long-term use of these drugs can increase sensitivity of dopamine in the brain, and that might lead to potentially worsening symptoms and leading to something like treatment resistance with these antipsychotics, where you try one, it doesn't work, you try another, it doesn't work, etc. And the idea, I mean, at least for me, I feel like the idea of dopamine supersensitivity is pretty complex, so I'll be covering this idea in detail in an upcoming video. But this is just one hypothesis suggesting why people over the long haul on antipsychotics might actually be worse off. All right, but so I want to get back to the some other limitations of the Chicago follow-up study. Some of the data they collected relied on patients' memories, which we know can be unreliable. We all know how unreliable our own memory can be. And so people might not accurately remember how often they experienced symptoms or how severe their symptoms were, especially over a long period. And I feel like relying on memory might lead to inaccuracies in the study's findings, making it harder for us to draw any sort of definitive conclusions about the long-term effectiveness of antipsychotic medications. And when I really think about it, it's difficult for me personally to remember what happened 2 to 5 years ago, let alone someone diagnosed with a condition that may occasionally make it difficult for them to distinguish between reality and fantasy. So I feel like relying on patients' memory is a pretty strong limitation to the study, simply because in and of itself, memory is often just very inaccurate. Another limitation to the study is the sample of patients itself. The sample came from Chicago hospitals, which might not represent all individuals with schizophrenia. And even if the conclusions in the study are valid, even if the conclusions we draw from the study are valid, they may not be applicable to everyone diagnosed with schizophrenia. Furthermore, the study only started with 139 patients. It's a small sample size, and at the end of the study, the sample size gets even smaller. It goes down all the way to 59 patients. So again, it's difficult to say how applicable these findings are from the study when the sample size is just so small. And at the same time, I think we have to, though, acknowledge what the study suggests. It's clear that continuous medication use doesn't guarantee fewer psychotic episodes or symptoms for everyone. In fact, those who were able to stay off meds often had fewer and less severe symptoms. So perhaps there's something going on here long term with antipsychotic use. Maybe when someone is on these meds for years, maybe it actually aggravates their symptoms. We can't really say definitively because of all the limitations of the study, but we can at least say that long-term use of antipsychotic medication doesn't necessarily guarantee a better prognosis. Another interesting finding of the study is that participants not on antipsychotic medications were significantly more likely to recover and less likely to be rehospitalized compared to those on continuous medication. This is a finding that really goes against everything we know about these medications. We're often told that being on these medications is a lifelong commitment to mental stability and to prevent relapse. But we got to remember that the study did control for the initial severity of schizophrenia and mood disorders, which is super important. This means that they made sure they were comparing people who started off with similar conditions. So when they say that people not on meds did better, it's not just because those people were less sick to begin with. The study accounted for that. It might actually just mean that being on antipsychotics long term actually makes people worse. So given all of this, what needs to happen? Well, I think moving forward, I think we really need more robust research to draw any sort of definitive conclusions about long-term antipsychotic use. We really need a study with, say, I don't know, like 1,000 patients where half of them are randomly assigned to medication and the other half are randomly assigned to placebo. And the researchers themselves are blinded so that they have no idea if someone is on a medication or not. And then we need to track all these patients over the course of, say, I don't know, like 5 to 10 years. I think 20 years for a study like that would really be pushing it. And I also think that this is kind of like a pie in the sky wish of mine. It's very difficult to conduct a study like that, especially when there might be times of emergency when someone really does need an antipsychotic medication. And then, like, what are we supposed to do at that point? Just be like, hey, sorry, this person can't have a much needed medication because they agreed to participate in a placebo-controlled double-blind study, and we've got another, say, 8 years before the study is completed. So, I don't know. I just feel like that's kind of silly. And then, like, even with the researchers being blinded, researchers, that doesn't really prevent them from knowing who's taking an antipsychotic and who is not. And the research even supports this, at least if they're going to do follow-up interviews and things like that, because to some degree, because of the side effects of the medication, the researchers know who's taking antipsychotic meds and who are not. And then lastly, even doing this kind of study is immensely expensive. And if we think that the pharmaceutical companies with all of their money are going to sponsor it, well, consider ourselves delusional. So as much as we might want more robust research, and as important as it might be, it's definitely kind of this pie in the sky wish, and I just doubt that it'll ever happen. So that's pretty much the gist of the Chicago follow-up study. Despite the study's limitations, I'd be curious to know what you think of its results and how its findings might be incorporated into our current treatment of schizophrenia and mood disorders. Or maybe you're just like entirely convinced. Maybe you're like, hey, this is all I need. This is the study for me. Not a perfect study, but close enough. What are your thoughts? Drop a comment below. Let me know. I've got a few more studies coming up in the next few months, hopefully, if I don't get too busy when it comes to questioning kind of the long-term use of antipsychotics. And I feel like these studies all sort of complement one another. But until then, we will see you in the next video.